Many people believe high blood sugar always shows up with obvious signs, like feeling extremely thirsty or needing to use the bathroom all the time. But what if some of the earliest warning signs were much quieter? So quiet, in fact, that many older adults mistake them for nothing more than a normal part of getting older. That happens more often than you might think. Small changes begin to appear little by little. A cut takes longer to heal. Your skin starts itching for no clear reason. You feel different, but you can't quite explain why. If you're over 60, today's video could be one of the most important health conversations you have this week, because these hidden symptoms are easy to overlook. Yet recognizing them early may help you speak with your healthcare provider before high blood sugar leads to more serious health problems. The good news is that your body often gives you clues, long before major complications develop. The challenge is learning how to recognize those clues, and that's exactly what we'll explore together today. Be sure to stay with us until the very end, because the number one symptom surprises many people. It's often blamed on stress, poor sleep, or simply getting older, when it may actually be your body signaling that your blood sugar deserves a closer look. Before we begin, we'd love to hear from you. Tell us your age and where you're watching from in the comments below. It's always inspiring to see this wonderful community of viewers from around the world supporting one another on the journey toward healthier aging. Your experience may also encourage someone else who is watching today. Now, let's begin with hidden symptom number 5. Imagine you're working in the garden or preparing dinner in the kitchen. You accidentally scrape your hand on a rose bush or nick your finger while slicing vegetables. It's nothing serious, just a small cut. A few years ago, that little injury probably disappeared within a few days. But lately, you've noticed something different. The cut seems to linger, staying red or tender much longer than you expected. Most people assume that's simply part of getting older. After all, aging does slow many of the body's natural repair processes. But when wounds consistently take much longer to heal than they once did, high blood sugar may be one possible reason worth discussing with your healthcare provider. So why does this happen? Think of your bloodstream as a network of delivery trucks. Every second, it carries oxygen, nutrients, and specialized immune cells throughout your body. These are the supplies your skin needs to repair itself after even a small injury. When blood sugar remains too high over time, it can damage the tiny blood vessels responsible for making those deliveries. It's a little like trying to repair a house when the construction materials keep arriving late. The workers are ready, but they don't have everything they need. As a result, healing can become slower than normal. Even a small scratch or bruise may take longer to improve than it once did. There's another reason as well. High blood sugar may affect how well your immune system works. Your immune system is your body's natural defense against bacteria and other germs. When it isn't functioning at its best, wounds may have a harder time healing and may be more likely to become infected. Let's look at a simple example. Margaret is 72 years old and loves spending time in her garden. One afternoon, she scratched the back of her hand while trimming her rose bushes. She cleaned it, covered it, and expected it to heal quickly. But more than 2 weeks later, the scratch was still noticeably red. She assumed it was simply because she was getting older. During her annual checkup, she happened to mention it to her doctor. Routine blood tests later showed that her blood sugar was higher than normal. While the slow-healing scratch didn't diagnose anything by itself, it became one important clue that encouraged further testing. That's something worth remembering. A single symptom rarely tells the whole story. But when your body begins sending several quiet signals at the same time, it's wise to pay attention rather than brush them aside. Of course, slow healing doesn't automatically mean you have diabetes. Many other conditions can also delay healing, including poor circulation, certain medications, smoking, nutritional deficiencies, or skin infections. That's why it's important not to jump to conclusions. Instead, think of slow healing cuts as an invitation to have a conversation with your healthcare provider. They can determine whether blood sugar or another health condition may be contributing to the problem. So what can you do today? Start by taking good care of even small cuts and scrapes. Wash them gently, keep them clean, and watch for signs of infection, such as increasing redness, swelling, warmth, or drainage. If a wound isn't improving as expected, or seems to be getting worse, don't ignore it. Healthy daily habits can also support your body's natural healing process. Eating balanced meals, staying physically active, getting enough quality sleep, avoiding tobacco, and following your healthcare provider's advice all play an important role. Small choices made consistently can have a meaningful impact over time. Now, while slow-healing wounds are fairly well known, the next hidden symptom often catches people completely by surprise. Many older adults blame it on cold weather, dry air, allergies, or even a new laundry detergent. But in some cases, it may actually be connected to blood sugar. Let's talk about hidden symptom number 4. Have you ever found yourself constantly scratching your arms, legs, or back, even though you couldn't see an obvious rash? Maybe you've switched soaps, tried different lotions, or increased how much water you drink, yet the itching just keeps coming back. Dry skin is certainly common as we age. Over time, our skin naturally produces fewer protective oils. That alone can make it feel rough or itchy. But when itching becomes persistent or unusually bothersome, it's worth taking a closer look. So, how could high blood sugar be involved? One possible reason is dehydration. When blood sugar stays elevated, your body may lose more fluid through increased urination. Even if you don't notice yourself using the bathroom much more often, that gradual loss of fluid can leave your skin feeling dry. And dry skin often becomes itchy. Another possibility involves circulation. Healthy blood vessels deliver oxygen and nutrients that help keep your skin healthy. Over time, high blood sugar may damage those tiny blood vessels. That reduced circulation can affect the condition of your skin and make dryness more noticeable. There's something else many people don't realize. Higher blood sugar may also increase the risk of certain skin infections, especially fungal infections that thrive in warm, moist areas of the body. These infections can cause persistent itching, redness, or irritation. Again, this doesn't mean every itch is caused by blood sugar, but it's one reason persistent itching shouldn't simply be ignored. Consider Robert, a 69-year-old retiree. For months, he noticed his lower legs were constantly itchy. He blamed the winter weather and tried several moisturizers. Nothing seemed to make much difference. During his yearly health check, routine blood work revealed elevated blood sugar. With guidance from his healthcare team, he began managing his blood sugar more effectively while also caring for his skin. Over time, the itching gradually became less bothersome. Robert's story reminds us of something important. Sometimes the symptom itself isn't the biggest problem. It's what that symptom may be quietly trying to tell us. Of course, persistent itching has many possible causes: dry skin, allergies, eczema, thyroid problems, kidney disease, liver disease, medication side effects, and other medical conditions can all play a role. That's why it's important to seek proper medical evaluation rather than trying to diagnose yourself. In the meantime, simple habits may help support healthier skin. Use a gentle, fragrance-free moisturizer after bathing. Avoid very hot showers that strip away your skin's natural oils. And unless your healthcare provider has advised otherwise, staying well hydrated may also help. Here's something interesting. Neither slow-healing wounds nor itchy skin can diagnose high blood sugar by themselves. But when these subtle changes begin appearing together, they create a pattern that's much harder to ignore. And the next hidden symptom may be even more surprising. Many older adults assume it's simply poor circulation or tired muscles. Yet it may actually involve the tiny nerves throughout the body. Recognizing it early could make a real difference. And that's exactly what we'll explore next. When blood sugar stays too high for months or years, it can gradually damage these delicate nerves. Doctors call this diabetic neuropathy, which simply means nerve damage related to diabetes or long-term high blood sugar. The damage usually begins in the longest nerves first. That's why the feet are often affected before the hands. At first, the changes can be very subtle. You might notice occasional tingling that comes and goes, Later, it may become numbness, burning, or even sharp shooting pains. Imagine walking across your living room barefoot. Normally, your feet tell your brain exactly what they're touching. You can feel the carpet, the cool floor, even a small pebble if one happens to be there. But when those nerve signals become weaker, your brain receives incomplete information. It's a little like trying to listen to a phone call with a poor connection. Parts of the message simply don't come through clearly. Let's look at an everyday example. David is 71 and enjoys taking a morning walk around his neighborhood. Over several months, he noticed his feet sometimes felt numb after sitting in his favorite chair. At first, he assumed it was because he was getting older. Then one morning, he stepped on a small object in the kitchen and barely felt it. That surprised him. During his next doctor's visit, he mentioned the numbness. Further evaluation revealed that his blood sugar had been running higher than it should. Now, it's important to remember, not every case of tingling or numbness is caused by high blood sugar. Vitamin deficiencies, certain medications, back problems, poor circulation, and other nerve conditions can produce similar symptoms. That's exactly why these sensations shouldn't be ignored, especially if they're becoming more frequent or affecting both feet. There's another reason this symptom deserves attention. Healthy nerves do much more than help you feel sensations. They also help protect you from injury. If your feet become numb, you may not notice a blister, a small cut, or a hot surface until damage has already occurred. For older adults, that can increase the risk of infections and falls. And maintaining independence often depends on keeping both healthy feet and good balance. So what can you do if you've noticed tingling or numbness? First, don't assume it's simply part of aging. Mention it to your healthcare provider, especially if it's persistent or getting worse. Second, make foot care part of your daily routine. Check your feet for cuts, blisters, redness, or swelling. Wear properly fitting shoes and avoid walking barefoot around the house if you have reduced feeling. Simple daily habits can make a big difference. Staying physically active, eating balanced meals, following your treatment plan if you have diabetes, and keeping regular medical appointments all support healthier nerves over time. And here's something many people don't realize. Sometimes nerve changes begin years before diabetes is officially diagnosed. That's why recognizing subtle symptoms early may give you an opportunity to take action sooner. Now, if you thought numbness was surprising, the next hidden symptom is even easier to dismiss. In fact, many older adults blame it on poor sleep, getting busy, or simply having one of those days. But sometimes, it may be connected to blood sugar in ways they never expected. Let's talk about hidden symptom number 2. Have you found yourself feeling unusually tired lately, even after getting what seemed like a full night's sleep? Maybe you wake up in the morning expecting to feel refreshed, yet within a few hours, your energy seems to disappear. Most of us experience tired days from time to time. That's perfectly normal, but ongoing fatigue that doesn't improve with rest deserves a closer look. At first glance, it may seem confusing. After all, if there's extra sugar in the blood, shouldn't there be extra energy? The answer is actually no. Think of sugar as fuel for your body's cells, but fuel only helps if it can get inside the engine. That's where insulin comes in. Insulin acts like a key, helping move glucose, your body's main source of energy, from the bloodstream into the cells where it can be used. When blood sugar remains elevated, that process doesn't work as efficiently. As a result, sugar stays in the bloodstream instead of reaching the cells that need it most. It's a little like having a full tank of gasoline, but no way for the fuel to reach the engine. The fuel is there, but the car still can't move properly. That's one reason people with high blood sugar may feel unusually tired, even though there's plenty of glucose circulating in their blood. There's another factor too. When blood sugar is elevated, your body often works harder to remove the extra glucose through the kidneys. That process may contribute to dehydration, and dehydration itself can leave you feeling sluggish and drained. Let's meet Susan. Susan is 68 and usually enjoys spending time with her grandchildren. But recently, She noticed she was running out of energy much earlier in the day. She found herself skipping afternoon walks because she simply felt exhausted. She assumed retirement had made her less active, and blamed it on getting older. During a routine health visit, however, her doctor recommended blood tests after hearing about her fatigue. Those tests showed her blood sugar was higher than normal. With guidance from her healthcare team, Susan made gradual changes to her eating habits, became more physically active, and followed the treatment plan recommended for her situation. Over time, she noticed her energy slowly began to improve. Of course, fatigue has many possible causes: poor sleep, anemia, thyroid problems, depression, heart disease, certain medications, vitamin deficiencies, and many other medical conditions can all leave you feeling tired. That's why persistent fatigue should never be ignored, especially if it's new, unexplained, or happening alongside other subtle symptoms we've discussed today. There are also simple habits that may help support healthy energy. Aim for regular physical activity that's appropriate for your ability. Eat balanced meals that include fiber, lean protein, and healthy fats. Stay hydrated throughout the day. And try to maintain a consistent sleep schedule whenever possible. Just as importantly, keep up with routine medical checkups. A simple blood test can often provide valuable information about your blood sugar and your overall health. So far, we've talked about slow healing cuts, persistent itching, tingling or numbness, and ongoing fatigue. But the final hidden symptom may be the one people overlook the most. Many older adults assume it's simply a normal part of aging. Yet in some cases, it may be one of the body's earliest clues that blood sugar has been affecting health behind the scenes for quite some time. And because this symptom can have a real impact on independence and quality of life, it's one every older adult should know about. Let's take a closer look at that important final sign in the next part. Let's continue. Now we've reached the number one hidden symptom, and it's one that surprises many people. Number 1. Blurry vision that comes and goes. Have you ever been reading a book, watching television, or looking at your phone when the words suddenly seemed a little blurry? Maybe after a while your vision cleared up again, so you assumed your glasses needed adjusting or your eyes were simply tired. That can certainly happen. But when blurry vision appears unexpectedly or seems to come and go, high blood sugar may be one possible explanation worth discussing with your healthcare provider. Here's why. Inside each of your eyes is a clear lens, much like the lens in a camera. Its job is to focus light so you can see clearly. When blood sugar rises significantly, it can temporarily change the amount of fluid in and around that lens. As the lens changes shape ever so slightly, your vision may become blurry. Then, if your blood sugar changes again, your vision may improve for a while. Imagine looking through a window. If the glass is perfectly clear, everything outside looks sharp and easy to see. But if moisture forms on the glass, the view suddenly becomes cloudy. Once the moisture disappears, everything becomes clear again. Something similar can happen inside the eye, although the process is much more complex. This is one reason doctors sometimes recommend waiting until blood sugar is stable before prescribing new glasses, because vision may continue to change while blood sugar is fluctuating. Let's look at another everyday example. Helen is 74 and enjoys doing crossword puzzles every morning. One week she noticed the words seemed fuzzy. A few hours later, everything looked normal again. She assumed she simply needed stronger reading glasses. But during a routine eye examination, she mentioned the changes to her eye doctor. That conversation eventually led to additional testing, which showed her blood sugar was elevated. Again, blurry vision alone does not mean someone has diabetes. Dry eyes, cataracts, eye strain, migraines, certain medications, and many other eye conditions can also affect vision. That's why any sudden or persistent change in eyesight should always be evaluated promptly by an eye care professional or healthcare provider. There's another important reason not to ignore vision changes. Over time, Consistently high blood sugar can damage the tiny blood vessels inside the retina. The retina is the light-sensitive tissue at the back of the eye that allows you to see. This condition is called diabetic retinopathy. The encouraging news is that regular eye examinations can often detect these changes early, sometimes before noticeable vision problems even begin. Early detection gives you and your healthcare team more opportunities to protect your eyesight. If you have diabetes, or you're at higher risk because of family history, excess weight, or other health conditions, routine eye care becomes even more important. Now let's pause for a moment. We've covered 5 hidden symptoms that many older adults never connect with high blood sugar. Slow healing cuts and bruises, persistent itchy skin, tingling or numbness in the feet, ongoing fatigue that doesn't improve with rest, and blurry vision that comes and goes. Notice something they all have in common. None of them automatically means you have diabetes, and none of them should be used to diagnose yourself. Instead, think of them as gentle warning lights on your body's dashboard. One warning light by itself may have many explanations, but when several appear together, it's time to pay closer attention. So, what practical steps can you take starting today? First, don't ignore changes that are new or persistent. Our bodies naturally change with age, but not every change should be dismissed as just getting older. If you've noticed one or more of these symptoms, especially if they've become more frequent or are affecting your daily life, schedule an appointment with your healthcare provider. A simple conversation and some routine blood tests may provide valuable answers. Second, focus on small lifestyle habits that support healthy blood sugar. You don't have to make every change overnight. In fact, gradual improvements are often easier to maintain for the long term. Try building your meals around vegetables, whole grains, lean sources of protein, healthy fats like nuts or olive oil, and fiber-rich foods that help you feel satisfied longer. Instead of sugary drinks, choose water, sparkling water without added sugar, or other beverages recommended by your healthcare provider. Look for opportunities to move a little more each day. That doesn't necessarily mean joining a gym. A brisk walk around your neighborhood, gentle cycling, swimming, gardening, or even chair exercises can all contribute to better overall health. The goal isn't perfection. The goal is consistency. Even 20 to 30 minutes of regular physical activity on most days of the week can support blood sugar management, heart health, stronger muscles, and better balance. Always choose activities that match your fitness level and speak with your healthcare provider before beginning a new exercise program if you have underlying health conditions. Sleep deserves attention too. Many people underestimate how important quality sleep is for overall health. Poor sleep may make it harder for the body to regulate blood sugar, while ongoing stress can also influence healthy lifestyle habits. Creating a relaxing bedtime routine, limiting caffeine later in the day, and maintaining a regular sleep schedule may all help support better rest. Don't forget your regular health checkups. Many people discover elevated blood sugar during routine screening, long before serious complications develop. That's one reason preventive care is so valuable. Your healthcare provider may recommend tests such as a fasting blood sugar or an A1C test, which measures your average blood sugar over the previous 2 to 3 months. These simple tests can help identify prediabetes or diabetes early, when lifestyle changes and appropriate treatment may be most effective. And remember, if you ever experience severe symptoms such as confusion, difficulty breathing, chest pain, sudden vision loss, or signs of a stroke, seek emergency medical care immediately. Those symptoms require urgent evaluation and should never be ignored. The most important message from today's video is one of hope. High blood sugar often develops gradually, and your body may give you subtle clues along the way. Learning to recognize those clues doesn't mean living in fear. It means giving yourself the opportunity to act sooner rather than later. Healthy aging isn't about being perfect. It's about paying attention, making informed choices, and working with your healthcare team to protect your health for the years ahead. Small steps really do add up. Choosing a healthier meal, taking a daily walk, staying active with family and friends, keeping your medical appointments, and listening when your body tells you something has changed. These simple habits, repeated over time, can make a meaningful difference in your quality of life. Before we finish, we'd love to hear from you. Which of these 5 hidden symptoms surprised you the most? Have you ever experienced one of them? Or learned something new from today's discussion? Share your thoughts in the comments below. Your experience could encourage someone else to seek the care they need. And if you found this video helpful, tell us your age and the country you're watching from. It's wonderful to see this community of healthy aging grow with viewers from around the world, supporting one another with kindness, encouragement, and practical knowledge. Thank you so much for spending your time with us today. We truly appreciate you being part of this community. Until next time, take good care of yourself, stay curious about your health, and remember, every small step you take today is an investment in a healthier, stronger tomorrow.